prevention education and service delivery is really a main part of a lot of what coalitions do. This is something that we do after we've done our needs assessment and collected data and understand what the problems are in our community. And really what we are attempting to do is educate a number of different audience members about what the risks are about certain substances.
We need to learn about prevention, education. We have to be at training and implement prevention education activities and programs. You must understand the frameworks, the models, the theories, and skill for successful service delivery and prevention education. The primary knowledge of group process and training facilitation skills, because it's very important to have facilitation skill, because this one might be used across all activities. Evidence-based program is very important for this domain.
One audience might be the youth themselves, another audience might be parents, and another audience might be community stakeholders and decision makers. So, our education needs to be tailored for the audience, but we do a lot of it. And it's a very vital part of what we do because it's a way of engaging people in the process, making sure they're aware of the problem, making sure that we use data to outline the problem specifically, that we're not saying we think there's a problem with marijuana, here's what we know. This is the data, what tells us that there is a problem with marijuana or whatever substance is in our community. So we need to educate, and I feel like that's an ongoing part of our work. We're always learning as prevention specialists, learning what the current problems are or what the changes are, so that we stay abreast of what the challenges are to be able to then convey that to our constituents.
We're all in a place where you could learn more or understand better. So that's where I think humility plays a role. I've certainly been in places of lesser knowledge. And being able to say oh, I don't know the answer to that, but I can provide resources, or I know how to look this up, or I know who to turn to, is I think a strength.
With all of our work for years, when we've done the strategic prevention framework, there is an element that runs through all of it, which is sustainability, but also cultural competence. So as prevention leaders, we've always been aware of the need to remain culturally competent. I think, given some of the climate that we've been in the past couple of years, it's really made that so important for us. So that could be something as simple as when we're creating a newsletter, thinking of the demographics of who would be reading this, making sure that the photographs we select represent the community that we're trying to reach, making sure that the reading level is accessible to the reader, making sure if we have a Spanish-speaking population that the materials are translated into Spanish. And then at other times, if we're having a presentation, say, at a library, making sure it's wheelchair accessible. So it's not just thinking about one specific race or demographic, but just thinking about all of the ways we can make sure our work is accessible to all.
I can give you an example. In the city of Providence, I'm working with one program they call Family Mara. This is the program, Family Mara. In the Family Mara, we're working with this group. We have a half group speaking, a half group speak Spanish. Because what I'm doing is, I delivered this service in both languages, in English and Spanish, because the community, the Latin community, they want to speak in their own language. I need to address the samples and the Latino community have. The white community, Latino community is total difference. The communication had to be two ways. So the first thing you have to understand is you need to listen to them. Okay, what do you understand from a mental health issue? After you understand what they're thinking.
So it's really about working with people where they're at. So for teenagers, that's doing activities. That's doing game shows maybe to learn more about substances. It's fun. Fun delivery is engaged delivery. When people see that what we're talking about is relevant to their personal experience, they want to have more control or knowledge, or feel more empowered in what we're talking about and how that relates to themselves. So then I feel the more empowered a young person is in their journey and understanding, the more that they want to empower other young people.
For Latino community, It's very, very easy when you told them, when you're talking to them your own experience. I talking my own experience or my neighbor experience or my community experience, they open up. They open up and they can tell you a lot of stuff. After that you can say, oh, do you want to have the referrals? Oh, do you want to visit at? Oh, can you call me? That personal relationship is helping them. You know, when the white community and Latino community is more warm. You have to be very warm with this community. They can understand you.
The other piece about that I think that is important is this concept of nothing about us without us. So if we're developing a program for youth, we really want to have youth at the table to make sure they're part of it. If we're developing something for substance users, say grandparents of children whose parents have died as a result of substance, make sure those grandparents are part of the table. So that's part, I see, of the cultural competence as well.
In the city of Providence, we passed this ordinance about tobacco-free. So let me see how I delivered this communication with them. The first thing I did is I went to the park. I started looking for the people they use cigarettes. I had the conversation with them one-on-one. This is one method. I hire people, Latino people, African American people. They can look like them. So to go to the park, you do the same thing. We had newsletter. We went to the radio program talking about these issues. We use our website. We have flyers. We put the flyer in the community. We have like a little TV program. We can use like the little thing to big thing.
But if there's a space in a program that you're hung up on, like there's probably a reason why. Or if there's like a group not participating, like there's probably a reason why, or a way. Because you're not just providing any of like this education to provide the education and say that you did it. It has to be like digestible.
Prevention is very important because you address the issue before happening. We want good things for our community.